Yeah. For example, I'm one of the voices in the autism community in Europe more than here. And in autism, it's estimated that parents spend between $35,000 and $60,000 a year for the care of an autistic child out of their own money. And much of that money is spent on lab testing. Less than a third of that is spent on actual treatment. And so by teaching parents the ART testing, they can significantly reduce the amount of money they're spending, and they can monitor their child on a daily basis, getting much quicker to improvements and to good results with it. So I feel, for parents of children in trouble, it is an absolute must. It's a compassionate thing to learn this technique, and it is to save these children. The potential is always there. Most of the autistic kids can be dramatically helped. Many of them can be completely cured, and I'm saying that word, if intervention is early enough and regularly enough. And the only people that can do that is the parents. And so I have trained hundreds of families in Europe, and the results of recovery of autistic children is just astounding. It's absolutely amazing what is possible with that. The same holds true really for Lyme disease. There is, for each 10 patients with Lyme disease that need a doctor, there may be one Lyme literate doctor for one of them, but not for 9 others. And there is a complete lack of education in the medical field to attend to the new illnesses. And we're providing that in the ART courses, the knowledge about the illnesses and how to monitor patients regularly and how to get much quicker to good results with the treatment. And so it's I do feel it's not possible for physicians anymore to keep up with modern illnesses in ways that are needed. And this coming time, many patients will have to be self-reliant more and more. And I think you, Joe, have been a pioneer with that, with your website to educate patients and people, regular people that are not patients yet, to educate them how they can gain the knowledge they need, do the lab testing, whatever is needed that they need, and then steer themselves towards better and more robust health. And of course, we're trying to expand that model by saying not only should people have an intellectual knowledge of what may be wrong with them and then trying out what may be working for them, but we also want to give them tools, diagnostic tools, that they can learn to go deeper with that and then come up with the appropriate healing tools that are appropriate to their condition. And I do feel there is a shift worldwide. I travel a lot from people depending in a sheep-like way on practitioners that tell them what's wrong with them. There's a shift away from that where the patients are much more educated, much more smart, and want to, on their own, figure out what's wrong with them and be able to bypass the medical community and just choose the healing tools from nature using natural ways that are not under the license of a physician, finding simple ways to regain their own health. And only when that fails do they want to see a physician. And I think it is the right way, it's the right process. Mm-hmm. We won't be able to stop that or accelerate that. It is happening in the greater field of consciousness, whether somebody likes it or not. Mm-hmm. We can stand in the way of that or not, but it will happen that in a few years, every patient that gets sick is not going to call their doctor, especially with chronic illness. They're going to go on the internet, find out the symptoms, go on websites like Diagnose Me. They're going to go on your website, increasing they are, to learn what actually the current issues are. Mm-hmm. None of us knew anything about vitamin D before Joe Mercola came around, and now it turns out to be probably the most profound, most common health problem in the whole country, you know, and it's just one man like you know, who uncovered that, you know, with the help of the people you contacted, and you spread the word that, you know, there is more patients now that know about vitamin D deficiency than physicians, because physicians don't read your website, you know, they know everything already.
Yeah, and our website does, yeah, it's true. But we do two things. We inform people of practical and expensive resources. But we also warn them of the fantasies, the media manipulations, the deceptions that are occurring to profit these multinational drug corporations like the swine flu. And I think we were enormously successful last year. We had campaigns that essentially resulted in 80%, 4 out of 5 people in the United States consciously choosing to not take the swine flu vaccine despite a public health emergency by the president and massive media campaigns on TV. You couldn't not turn on the TV and get bombarded with these urgent threat alerts to get this vaccine, but only 1 in 5 chose to do it, which is amazing. So people are waking up. They need to be empowered. They need to learn these types of techniques. So if they want to do ART, I think, you know, my understanding is you do it, essentially it's like a school. You do it once a year and you go through 3 or 4 different stages, and you can jump at any point, but I think you also have some DVDs. So I don't know when someone listens to this, it's, you know, it may be out of sequence, but maybe you can sort of describe, you know, different options and when they might jump in and when they may not.
Mm-hmm. So autonomic response testing is a very concise, a very tight training program in this diagnostic process. It teaches the basics of a good medical exam, using your hands, you know, the hands-on medical exam, like the reflexes and the palpation skills, and it takes you through that. And then it teaches you in the ART1 course the basic muscle testing skills, where you can already, after the course, diagnose very accurately food allergy, metal toxicity, or the presence of certain infectious agents in the body. And then there is 2 further courses, ART2 and ART3, which then teach more illness-directed diagnostic processes. You know, what do you do with Parkinson's disease? What are the specific diagnostic things you need to watch out for? What are the tools that are available? How to apply them, and so forth. But ART1 is really the course that gives everybody the basic tools they need to understand their illness or somebody else's illness, and how to evaluate the tools that are available to treat it. And we recommend that people take these 3 courses over a 1-year period, so that they have enough learning in between the courses. And then I teach a second series of courses, which are simply treatment courses. And my main treatment that I use as an initial treatment for people is the psychological work. You know, I do feel that the chronic illnesses are always shaded by the psychology of the person. Somebody can be in bed with chronic illness and not being able to lift their eyebrows for years, or they can have a slight discomfort in their back, still working with the same exact illness, and the difference being their psychology. So I teach courses and an application of simple psychological tools, you know, the EFT, TFT, MFT, family constellation work, simple tools that people can learn briefly to understand the psychology of themselves, of the patient, and simple tools to heal what needs to have healing. And then I have other classes, you know, where I teach detoxification protocols and protocols for treating chronic infections. And that's about sums it up. That's sort of my whole program.
Okay.
When people have taken all the workshops, you know, they know how to diagnose, and they know how to use the current non-invasive healing tools for all the current medical illnesses that we sort of encounter on a daily basis.